Minnesota Department of Human Services, Disability Services Division. Are you looking for a career where you can make a difference in a young person's life? One career path that is particularly in high demand is the behavioral health field, in which you can find a variety of different job opportunities. In this video, we will highlight the work of behavior therapists. Behavior therapists often work with children, youth, and young adults with autism spectrum disorder, or ASD, and related conditions.
My favorite thing I think about working as a mental health therapist is seeing that aha moment when they finally get something or they finally can accomplish doing something independent. I think that's amazing, and having that big celebration for such a small thing I think is the most incredible thing.
With the rates of ASD diagnosis drastically increasing, there is a critical shortage of providers to offer care, which can result in significant barriers to children and families accessing services.
The thing I love most about the work that I do is knowing I get to make a difference in a child's life while supporting their family and friends.
Why choose a behavioral health career path? The human services industry is first and foremost known for helping people to live their best lives and achieve goals that are important to them. Behavioral health providers tailor care to each person's strengths, interests, values, and preferences. This includes working on meaningful skills that will increase independence and participation across the home, school, and community environments. You'll focus on their priorities and helping them achieve what is important to them and for them. The behavioral health field asks what a person wants to achieve and how to help them get there. Your work will be data-driven and based on what has proven to be effective in producing important outcomes for the child and family.
Monitoring the progress of the kids I work with is really rewarding. Finding different approaches that work for different kids.
Behavior therapists often work with children, youth, and young adults with autism spectrum disorder, or ASD, and related conditions. They will also work alongside other dedicated professionals working with the Early Intensive Developmental and Behavioral Intervention, or EIDBI, benefit, which supports people with ASD and their families. ASD is characterized by differences in communication and social skills, as well as the presence of repetitive or restrictive interests and behaviors. Young people on the autism spectrum often have strengths in the areas of visual processing, focus, memory, special interests, and more.
Be silly as much as you can because children like to have fun and they learn best when they're playing.
Behavior therapists, also known as behavior technicians, deliver direct intervention services in one-to-one or small group settings. They help build communication and social skills, self-care and activities of daily living skills, safety skills, self-regulation skills, and independence and adaptive functioning. The goal in helping support the person acquire these skills is to help them live their best lives and participate in the fullest extent at home, school, and in the community. As a behavior therapist, you will know that your work is making a direct impact on not only the individual person's life, but also their family and the community as a whole. You can work in a variety of settings, including, but not limited to, offices or clinics, center-based programs, schools, in people's homes, as well as out in the community. Some positions even allow you to work remotely to provide services via telehealth.
What I love most about the work that I do is that it is constantly changing and you can see on a daily basis how you are really impacting children and their families.
On a typical day, you will arrive at the person's home or center and greet the person and their family. Then, to prepare for your day, you will review case notes, analyze data from previous sessions, and gather all necessary materials. Behavior therapists will typically work on very specific goals, often to help support the person with activities of daily living, communication and social skills, safety awareness, and practicing routines. Therapists in advanced positions may coach other staff, help support family members and caregivers, provide consultation, or conduct assessments. Finally, you will summarize the progress and make a plan for the next session. It's important to communicate regularly with the person, their family, and your team members to effectively provide consistent support and adjust programming if needed.
When I first applied to work in the ABA field, I was nervous because I had no experience, but the tools and education that you were provided to become a behavioral therapist helps you grow into a confident therapist working with children.
Entry-level positions often do not require any previous experience, since many employers often offer hands-on training and mentoring opportunities to help you quickly gain the skills you need. However, experience will help to set you apart from other applicants. Experience can be gained through volunteering or job shadowing, as well as part-time or full-time employment. Completing a practicum or internship while you are in school is a great way to explore different areas of this vast career field. Many employers are also looking for special skills like speaking a second language or experience caring for a friend or family member with a disability.
I look forward to clients, seeing the smiles on their faces, them being receptive towards the therapist, and the progress they have made. That's really rewarding.
There are different career levels associated with being a behavior therapist. The more education and experience you have, the more opportunities for career advancement and higher salaries. Each provider level will work directly with children, youth, and young adults accessing early intervention services. However, the roles and responsibilities will vary based on the level and agency you work for. Entry-level, or Level 3 jobs, require a high school diploma or equivalent. Level 2 positions require a bachelor's or associate's degree, or being enrolled in a related degree program, such as psychology, human services, or education, and experience in the field. Level 1 positions require being in a master's degree program, experience, and advanced certification. All of these levels will provide hands-on training and mentoring to quickly gain the skills you need to succeed in your role. In advanced positions, your role and responsibilities will change and grow. You may complete evaluations, write intervention programs, train other providers, and help supervise the day-to-day services that are being provided. To be a supervising professional or a comprehensive evaluation provider, you must be a licensed physician, advanced practice registered nurse, or mental health professional, such as a professional clinical counselor, marriage and family therapist, or independent clinical social worker.
What is special to me is family training. That's where I first started, and I fell in love with family training and ways to assist parents that are going through hardship, that have multiple kids, showing them services that are available, connecting the dots for them.
There are several ways to start your job search. The Minnesota Healthcare Program Provider Directory has a comprehensive list of employers, which you can search by category and location. Go to the link shown here, which you can also find in the description section below. You can reach out to potential employers to ask about job opportunities or browse their websites. Another way to hear about job opportunities in the human services industry is to attend job fairs and events, or by searching job postings on Indeed, LinkedIn, Handshake, Career Hub, or other career listing sites. Employers may describe behavioral health job postings differently, so use different keywords such as behavior therapist or technician, direct support professional, paraprofessional, positive support worker, personal care attendant or PCA, registered behavior technician or RBT, community health worker, or mental health practitioner. All of these positions offer entry-level opportunities in the human services career field. Thank you for taking the time to learn about human service career opportunities. Visit the Minnesota Autism Resource Portal for more information and training, which you can find linked in the description section below. If you have questions or would like more information about human service career opportunities, contact asd.dhs@state.mn.us.